My name is Dr. Robert Gould. I'm a medical physicist in the Department of Radiology and Biomedical Imaging at the University of California in San Francisco. We implemented DoseWatch 8 months ago. It is connected to both CT and to our angiographic equipment. We are highly specialized within the Department of Radiology. We have a large research group that is on the order of 30 PhDs. We are about a 600-bed hospital. We were an early adapter of DoseWatch because we were concerned about our radiation levels, not that we felt they were unnecessarily high, but we wanted to be able to monitor and track these. So DoseWatch is an excellent tool for retrospectively tracking, monitoring dose levels from given procedures. DoseWatch has allowed us to follow procedures, the dose from different procedures very effectively. So we're able to see the impact of changes that we make. The increase in CT and in image-guided procedures has resulted in an increase in radiation to the population, and there is considerable concern about this. So there is a theoretical risk associated with the radiation that is given in a procedure, combined with an actual benefit. And the task is to maximize the benefits in comparison to these theoretical risks. There is always a relationship between the dose you use and the quality of the image. That's a difficult balance to achieve, how much dose to use for a given image quality. You need a quality that will give you confidence in making the diagnosis. Part of my responsibilities is to make sure that the protocols that we have set up on CT and in our interventional angiographic rooms follows the ALARA principle, as low as reasonably achievable. We've connected DoseWatch to both CT scanners and to angiographic equipment within our department. We have a number of CT scanners, we have a number of angiographic rooms. They weren't all purchased at the same time or from the same vendor. DoseWatch allows us to quickly identify patients that have gotten doses that you might not expect. In other words, outliers for a given type of procedure. All of the machines send the dose information to DoseWatch, and we use this to help train our technologists and our physicians about how to minimize radiation exposure in a given procedure. DoseWatch then allows us to see the impact of changes that we make in our techniques or in our protocols. It's a very effective tool in allowing us to determine how changes we have implemented have improved or reduced patient dose. Trying to achieve that balance between the dose we give, the quality, and the diagnosis, so that we are assured that the benefits greatly outweigh the risks. Many patients are very interested in the amount of radiation for a given procedure. That's actually a very tricky question. DoseWatch will assure us that we are using an appropriate level of radiation. It helps us track the levels of radiation that we're using for a given protocol or procedure, and allow us to say to a patient, we are making an effort to minimize radiation exposure. I think it's a very exciting time to be in imaging, because there are so many innovations that are occurring. That completely accomplishes what we're trying to do here, maximize the benefits while minimizing the dose. DoseWatch is going to enable us to document that we've accomplished this.
Hi everyone, welcome to this DoseWatch session. about how an optimized dose management tool can help you in improve patient care in the radiology area. I'm Pilar Pujadas, Clinical Product Manager for DoseWatch, which is in the Performance Intelligence Analytics area of GE Healthcare. Let me first explain what is DoseWatch. DoseWatch is a solution that automatically collects and analyzes radiation and contrast dosage data across facilities, modalities, and manufacturers within your imaging network to enable compliance. These automatic tracking capabilities make it easy to access a wide range of data to ensure low dosage strategies. DoseWatch is a solution collecting multimodality and multi-vendor devices from the radiology department and helping you to have all this data in a consolidated place. Once we collect the data, DoseWatch is adding new calculations, helping you to get more visibility on the dose that was delivered during the examination. Once we have all this data, let's say the one we collected and the one we measured, how is this helping us from a GE point of view and from a radiology department point of view? It's first helping you to drive awareness, getting those notifications early and often to identify outliers in patient dose. This will be at a patient level. You will be notified when an examination was not done within the dose levels you defined. Second, it's helping you to enhance workflow, improving workflow through access to patient dose history and integrated EMRs. You will have access to this patient dose history, helping you to get more visibility on all the examinations that were performed to this patient and giving you some recommendations on the cumulated dose already received by the patient. Third, it will help you to maintain compliance. Many countries have today those reference levels that needs to be taken into account, and these national authorities are also asking to get visibility on the doses you are delivering to your patients. DoseWatch will help you to be compliant with these requirements. And finally, the optimized patient experience. At the end, we are doing all these steps to give a better patient experience and an improved patient care. I'm going to give you a few examples on how DoseWatch is adding new data thanks to the one we are collecting from your imaging devices. We have first the 4D skin dose map, which is an interactive skin dose map helping you to reproduce interventional procedures and to check what can be optimized for future procedures and to evaluate if there is some risk for skin injury. Second, we have the Duke organ dose calculation. We have the Duke organ dose methodology integrated in DoseWatch, helping you to get those organ dose values after one specific examination. And third, as an example, dose to fetus calculation. In case of pregnant women irradiated, you will be able to get the dose to fetus calculation into DoseWatch. Today, I'm going to focus on one of our customers, Groupe 3R, Réseau Radiologique Romand, a Swiss private imaging network with 13 centers in the French-speaking part of Switzerland. As for today, they have about 150 employees with around 30 radiologists and above 50 radiographers. Groupe 3R Dose Excellence Program began in 2015 within with the installation of DoseWatch and the publication of a new European Basic Safety Standards Directive, which they had to comply with. Group 3R and GE organized a 2-day workshop and brought together one radiologist and one radiographer from each center in order to define Group 3R vision regarding radiation protection and patient safety.
Group 3R is a Swiss private imaging network with 13 centers in the French-speaking part of Switzerland. Our Dose Excellence program began in 2015. We organized a 2-day workshop with the help of GE, and we defined our common vision, which is to deliver the right dose for the right diagnosis to each patient and for each clinical indication.
Once the concept was defined, we implemented in Group 3R the Dose Excellence Program methodology.
We designed a clinical indication protocol map based on 2 categories of patients. One category was related to patients with a BMI of less than 25, and the second category with a BMI above 25. For renal tumor diagnosis, we managed to reduce the dose by 50% additional for non-overweight patients compared to overweight patients. For pneumonia, it was 40%, and for CT colonography, it was 30%. The dose we delivered, for example, for pulmonary embolism, was 30% less than the common Swiss standard. The main benefit of this Dose Excellence program is for the patient.
In the future, DoseWatch will help us to reevaluate our dose reference level with the outcome of a new algorithm of reconstruction.
GE came up with a concept and supported us through the entire Dose Excellence program.
During the year, we have multiple touchpoints with Group 3R, which objective is to keep this strong partnership that we have with them.
I'm talking now about Dose Excellence program. I'm going to detail how GE defines the what we call Customer Success Excellence program. This is organized in 4 pillars, as you see here, 4 steps. First one will be to diagnose. We need to first understand which data we are collecting and to benchmark where we are, where we stand, to get more visibility on this very first step and mandatory step, I would say. Once we know where we are, we need to move with the practice harmonization. We need to compare apples with apples, and for that we are performing the protocol harmonization. Once we have done that, we can move to the third step, the optimization. We need to define which KPIs we want to track and what is the goal of our optimization. This can be done from a dose perspective, from a contrast one, exam duration, image quality. We have tons of KPIs, so we need to first decide which ones we are going to work on. Once we have defined that and we have identified the optimization actions, we can proceed with analysis of the data after the optimization and assess the outcomes. Going to the 4th step, which is the communication. The communication is a very important step to create the dose culture. We need to explain to the internal teams, but also to the customers, the outcomes that were achieved and the reason why we decided to move with these outcomes. This will help everyone to feel more comfortable with the dose culture and to understand it. Coming back to the Group 3R example, there was a first challenge identified in 2015 when we started this Dose Excellence program. It was to harmonize and optimize protocols per clinical indication and BMI. So what we did first, as I was saying, diagnosis. We did a benchmark across all the sites, and the first decision was to harmonize the protocols using the RADLEX mapping per clinical indication. Why we decided to use the RADEX mapping? To give more visibility on the clinical indication. Group 3R moved from an anatomic region-based protocol to a clinical indication. The goal here was to use the right protocol for the right clinical indication, meaning the right protocol, the right dose, because we all know that a protocol can be configured in multiple ways, and the goal here was to directly access to the right protocol for each patient, depending on their clinical indication. So moving with this harmonization phase, Group 3R decided also to split all the protocols, not only per clinical indication, but also for BMI, doing 2 BMI categories, lower than 25, which is non-overweight patients, and above 25 of BMI, which is what we can consider overweight patient. The goal of this was to follow the vision of the right dose for the right patients for the right clinical indication. Not a patient with a high BMI should not receive the same dose that a patient with low BMI. That's why we decided to split all the protocols in these two categories. And all of this was performed keeping the right image quality. In some cases, the dose was reduced, but with a good image quality validated by the medical physicist from Group 3R and by the GE application specialist. Once this harmonization and optimization phase was performed, again, keeping this vision of the right dose for the right patient for the right clinical indication and keeping an acceptable image quality, the Group 3R calculated their local DRLs based on clinical indication. And what they did is to compare the Group 3R DRL with the national DRL. As you can see here, for the chest anatomical region, we have the in red we have the national, the Swiss DRLs, and then we have for each clinical indication, so emphysema, pneumonia, and pulmonary embolism, we have one different DRLs, the ones coming from Group 3R. And what we can clearly see is that Group 3R is always delivering lower doses compared to the national recommendations. So here we achieved an average a 26% dose reduction compared to these national DRLs. At the end, meaning that a patient going to Group 3R center will receive much lower less than the one that he might receive in another center following the national recommendations, which are already optimized in terms of dose, but not that optimized than in Group 3R, thanks to this dose excellence program that we performed. After finishing, this is a process that never finished because we need to keep optimizing always and moving with the technology. But once the main actions of the dose excellence program were performed, we moved with the second challenge, the contrast optimization. So here the goal was to optimize and personalize contrast injection rules for liver procedures. What we need first, same then again, benchmark. We need first to do this diagnosis to know where we are. And here you see the enhancement, practice. And we can quickly see that there is a high variability. We are not always enhancing in the same way for our liver examinations. And if we define this between the red lines, we define the accurate enhancement, we see that only 22.4% of the patients were enhanced in the ideal range. So here, what was the action? The group 3R identified an harmonized injection rule in order to get always the same enhancement, which was 50 Hounsfield unit plus minus 10 of margin of enhancement. So for targeting this harmonized enhancement across all the patients for the liver procedures, they defined a contrast injection rule based on the fat-free mass. Why based on the fat-free mass? Because contrast is only going to the muscle tissues. It is not going to the fat tissues. So if we consider the BMI, we will be taking into account fat mass and fat-free mass. And here in this case, we are only considering fat-free mass because the contrast is only going to this muscle tissue. And the rule defined was to inject to everyone 600 milligrams of iodine per kilogram of fat-free mass. This is, if we follow the dose excellence program, this is in the same vision of the right dose, the right injection, here also for the right patient. As you see, as this formula is working based on per kilo of fat-free mass, the value to be injected, the volume to be injected will be different for each patient based on its anatomy and based on its fat-free mass. And once applying this rule, so once we moved with this harmonization and optimization of the contrast injection, what we need to do is to evaluate the results and to check what is the outcome of this contrast excellence program. And here in this case, we realized that now 70% of the patients were enhanced in the correct way compared to the 22 that we had before. Additionally, thanks to the fact of giving an enhanced harmonized rule, helped to reduce the contrast iodine by 30% comparing these two phases. So at the end, we are improving the practice in a more standard way. We are improving the patient care thanks to a dose reduction, and we are improving the full workflow of the patient in the CT liver procedures.
Group 3R is a radiology network in the French-speaking part of Switzerland. We're a team of subspecialized radiologists and general radiologists working closely with different radiographers in 13 radiology centers.
Proven the success of the dose excellence program, we also apply this methodology for the contrast excellence program, reinforcing our partnership on the data analysis.
We evaluated the amount of contrast we injected to the patient and realized that we were systematically over-enhancing our patients. In the end, we calculated that the optimal amount of contrast media we should inject to the patient is 600 mg per kilo of fat-free mass.
Donc on différencie, on personnalise la dose en fait, que ce soit d'irradiation ou la dose de contraste.
Based on the good results we obtained, we elaborated an algorithm which is now in use in Group 3R.
The developed algorithm allowed us to increase the number of patients within target enhancement from 20% to 62%. Thanks to the algorithm, we were also able to reduce the percent of patients with over-enhancement from 79% to 32%.
By generalizing this approach, everybody will be able to use our algorithm and deliver the right dose for the right diagnosis.
For the future, we would like to introduce deep learning technique to fine-tune our algorithm even further.
We have the people from GE who supported us right from the beginning, helping us to optimize the data that we collect.
During the year, we have multiple touch points with Group 3R, which objective is to keep this strong partnership that we have with them.
GE supported us through the entire process, and I wish to thank them.
For more information, you might want to scan the QR code to learn more about exclusive offers from GE related with DoseWatch 2. Thank you very much for your attention.